Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Going to have a conversation with Dr. Raymond Liu. He's joining us on the program to talk about some research that details how Kaiser Permanente Northern California has ramped up its existing telehealth oncology program due to the COVID-19 pandemic. Welcome to Health Professional Radio, Dr. Raymond Liu. Thank you for taking the time this evening.
Thanks for having me on your program.
What is your background in healthcare?
I'm a medical oncologist practicing in Kaiser Permanente, San Francisco. I did my training originally in the University of Chicago and then moved out west to pursue further training in oncology and internal medicine out at UCSF and came to Kaiser Permanente about 12 years ago as a practicing clinician. And most recently became our director of cancer research for the Northern California area. Prior to that was heading our survivorship program in Northern California and also chief of our department in San Francisco.
In recent years, prior to this COVID-19 pandemic, we were hearing a lot about telemedicine, telehealth, teleconferencing has been going on for decades. And when it comes to telehealth, telemedicine, that covers quite a large area, especially nowadays, does it not?
Yeah, you're absolutely right. I think when people talk about telehealth, they really refer to video visits or this scenario where you're on a Zoom call, something where your face is projected on a screen. But telehealth really is also the secure messaging, the emails we send to patients, the telephone calls that we provide in terms of those services.
Now, like I said, we were hearing about telemedicine and telehealth, but as a result of the COVID-19 pandemic, telehealth has exploded. We're doing everything remotely and as touchless as we possibly can. What are some of the things that you all have done specifically to ramp up what you already had in place as far as oncology telehealth?
Well, I think our first foray into telehealth really was actually over a decade ago, where we first had our electronic medical record and provided an opportunity for patients to interact with us through emails. And we have a lot of extensive experience with that. That's been very, very helpful for our patients to get access to care, no matter where they are, as long as they have an email address that's logged in with us. And we saw that the majority of our patients were able to engage in that way. I think cancer patients are a little bit different because in many situations they have caregivers that can help them. In many situations, their preference for telehealth really is driven by the fact that it's harder for them to get to visits in the first place. And so our patients really gravitate towards telehealth very, very early on from emails and, of course, when possible, telephones. We have offered video visits as well for quite some time, almost a decade, and have had some experience with that, and that experience has been very, very positive. So when COVID came around, it was pretty dramatic of a shift because we were actually seeing patients proactively reach out to us and say, hey, not only do I like the prior services, I want to dramatically increase that level of service because I'm concerned, not just because I have that great experience with telehealth in the past, but because I'm immunocompromised, I have cancer, and I'm weaker, and their concerns were that if they came to the medical center, that they would be exposed to the pandemic.
Now, there was a paper concerning exactly what we're talking about published in JCO Oncology Practice. Is that correct?
That's right. So we wanted to write about it because we realized that there were many practices out there that may have not had as much experience with telehealth. And we also wanted to let folks know that you can do telehealth in many different ways. Again, because oncology sometimes is a sensitive topic, we're talking about many situations that are very, very critical to a person's life and the quality of life. And so I think there could be a perception that telehealth is very, very difficult to do and that in-person visits were preferred. And what we wanted to show was that if you did it in a sensitive way that honored the patient's needs and also was very, very good for care, that patients would gravitate towards it and it could be a successful practice.
Now, even without telehealth, telemedicine, there are obvious disparities in healthcare accessibility, even when it comes to trusting technology. How can telehealth, especially now that it's ramped up to such a level, maybe alleviate some of the disparities in access, in trust in technology, and in care in general?
I'm so glad you asked that because with every technology, there's something that's really good and there's something that may not be as good. Speaking about the things that are really positive about telehealth, we could look at both, for example, the providers that are delivering telehealth and also the patients. One good example from the provider standpoint was our ability to be able to continue to do our telehealth conferences. So what we were able to do is bring our experts from around the state and be able to discuss patient cases in a remote way. And that's true for not just our administrative conferences, but also with the direct patient care, where we are able to project a patient scans on a screen and actually share our best practices and understand what's the best way to treat the patient. On the patient level, what we found was that patients really actually benefited because they didn't have to bother their caregivers to take off work. They were able to do things in the comfort of their homes, especially in their weakened state. So there were benefits definitely from both the provider and the patient side. As you say, though, that there are also some challenges. And what we found was that some things got better in terms of healthcare disparities. So, for example, we've shown for a while, but we could do video visits with people in multiple locations. So we would be able to bring in loved ones from across the country, across the world sometimes, to these conferences, and we could share the screen with them and let them see what the scans look like and talk to them in person, connect with them in a real way. On the other hand, what we also found is that while it could help in care and providing care to rural areas and in places all across the country that were, in the terms of distance, very far apart, that sometimes what would happen is people would not be able to engage with this technology if they didn't have high-speed internet, or if they had difficulties with their telephones, or even if they didn't have an email account. What we also have seen is that folks that don't speak necessarily, don't speak English or have languages that are harder to find translators for, that those are populations that we really have to pay attention to.
Well, we'd like to get some more information about Kaiser Permanente Northern California and about more about telehealth, telemedicine, especially now during the COVID-19 pandemic, but just in general. So
Kaiser Permanente Northern California is a fantastic place to practice for me because we really work in an integrated system where all the doctors are there on behalf of the patient. So what we're there to do is provide the highest level of care, and that is regardless of where we're located in Northern California and really all across the network. So we share our best practices, and we have a common electronic medical record, and we've always been in a situation where the patient's care comes first. And so what that means in terms of telehealth was we want to honor the patient's preferences, but we also want to make sure that we're very, very specific to the individual. So what I mean by that, for example, is when the COVID-19 pandemic came out, we went to our physicians and we said, let's work together in our infusion centers, in our clinics to help protect our staff, to help protect our colleagues, to protect our patients. How do we do that best in each medical center, and how do we help each other do that? And so we allowed our individual physicians to have conversations with their patients on what was best for them, and at the same time provided them with the support and technology, provided our patients with the support they needed to engage with that technology, and then really helped explain through our websites and through our outreaches to patients directly how they could really, really help improve their health while still sheltering in place.
Give us a website where we can go.
Of course. So kp.org is our national website, but we have it, if people are interested in the app, we have a My Doctor Online app, which allows people to come into that portal and understand everything we're doing about COVID-19. But I would say that the national app is our best place. My Doctor Online is our second best place.
Appreciate you coming in and speaking with us this evening.
Of course. Thank you so much for your time.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Raymond Liu. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.